Presentation, taking care, case 2. In the company there are 3 managers and 8 nurses. Friends signed and I started a new business in Brandon, Manitoba. We are providing home care to elders in their homes. We assist them with medication and self-care needs. Friends signed is a registered nurse and I am a business manager. Francine is the expert of patient care, and I am controlling costs and making a profit. We have some arguments about decisions. She wants to buy the most expensive and high quality supplies. And I agreed to buy quality, but should not be the most expensive. There are 8 registered nurses on the staff and 1 administrative assistant. Francine and I need to evaluate what I need in this new staff. The overtime of the nurses is the largest expense that I have now. The nurses are making 2 hours of overtime each day. They spend more time with the lonely clients, but they are late for their next appointment. I am not sure if overtime is necessary, but for Francine, it is necessary. She always approves it. Some nurses are complaining about the housekeeping duties because they don't like mop and sweep the floor because they are professionals in healthcare. Actually, I agreed with them because they are earning a high salary for mop and sweep the floor. Another problem is my administrative assistant, Georgette. She's late almost every day, and she has been very impatient and rude with clients. I know about it, but I haven't told her anything yet. One of the nurses, Ginny, told to Georgette why she is a rude old bat with clients. Georgette came to me in tears. She wanted me to do something about Ginny's behavior. I can see 9 facts in this case. I want to evaluate what is I really need in this new staff. The overtime is the biggest issue. It's the largest expense I have, and it's out of control now. The nurses usually couple and spend a little bit more time with elders. I have no way of knowing when overtime is actually necessary. Some of the nurses have started complaining they are not happy that some of the services that we offer are more housekeeping than medical. They feel it is below them to sweep and mop the kitchen floor. The nurses have a high salary, too much for this type of job. Georgette has been coming to work late frequently these days and has been impolite and impatient with clients. One of the nurses, Ginny, told to Georgette that she is a rude old bat to clients. Georgette come to me in tears. She wants I do something about Ginny's behavior. The strategy that I recommended is high involvement manager strategy. The factors in this company that indicate me why high involvement strategy is the most appropriate managerial strategy were the 9 facts and the contextual variable. In the contextual variable, we can see environment. The environment in the company is complex, service, health, and caring, right? Business strategy is prospector differentiator, unique and quality service. Technology is sharing ideas. Communication is very important. Size. The company is small, 11 staff. Workforce, highly educated. Managers and nurses. High involvement strategy exists these elements. Jobs are interesting and challenging. Nurses are professional and challenger. Provide workers with considerable autonomy when it comes to planning and executing the work activity. The nurses will take decisions and being more responsible. Joint employee management, planning, and goal setting are often used. Managers and nurses agreed about goals and responsibilities. Coordination is horizontal as well as vertical. Communication between nurses and managers, between nurses and nurses, and between managers and managers. I will know if overtime is necessary because the nurses will communicate if they can stay longer, or they will communicate to other nurses. High involvement strategy management. Communication is a major focus of management attention. Great effort is made for communication to flow vertically and horizontally. With great communication, Jeannie and other staff could talk to me about Georgette's poor work and about her impoliteness toward the clients. And will not be necessary, Jeannie tell to Georgette rude or bad. And we could have a meeting to tell Georgette that she should improve her job, and that will benefit to the company. I and Francine should have more communication, have agreements, and take decisions together. We will work like a team. Nurses can communicate to managers that is necessary to contract to housekeeping. I could communicate to the nurses that is not convenient to the company they be late to their next appointment. High involvement management strategy benefits. With high involvement strategy, our company will have more opportunities to get our goals. We will provide an excellent service. If we provide an excellent service, we will get more clients. And if we will get more clients, we will increase the company profit. That is the most important for me. In the picture, we can see nurses and managers working as a team. The strategies that I don't recommend is the classical strategy. We cannot use classical strategy because it is designed for employees with lower levels of education. Examples: factory laborers, restaurants, and hotel staff. However, in our case, we have a complex service and our staff are educated and professionals. Even the nurses were not happy doing housekeeping duties because they know they are professional and they have studied hard for become professionals. With classical strategy, the nurses will not be able to use critical thinking and they don't see the responsibilities. Example, they spend more time with clients even if they know they have to visit other clients' house. In the classical strategy, there are some basic elements like supervised closely, replaced easily, and dismissed. In the picture, we can see some laborers in a factory.